Hi everyone, I'm here with my good friend and willing movie making participant, Cindy. And this is the real treatment. Cindy is a professional pilot and has a lot of trouble with her left SI region in sitting. So right now what I've got is the Viper vibration roller on a part of her abdomen just above her pelvis or her hip. And that's working on one point that I started on her to kind of loosen it up, soften it up so it's not so daggone painful. I've already started treating her there. But what I'm going to do now, while she's got that on, instead of just standing here doing nothing, I'm working on the other site, and she's trying very hard not to make guttural noises, but it would be all right. So I'm on another point down the leg that I think is playing into this left SI symptom pain stuff that she has that's really rough on her. So right now I'm on the short head of her biceps. It's a point called extragenu. It's in the fascia manipulation model. It's just one of the points. And it's very densified. So this is what, from my perspective, what the manual care looks like for fascia manipulation. And then I'm going to use these other tools to help me. Now, well, she's got that going. I'm going to give her a break from me because it hurts. And I'm going to give me a break just because I got more people I got to work with today. But I'm going to use the percussion device on this point. And I don't always do two things like this at the same time, but it just happens to be the way this is working out. So I'll use this on here for, I don't know, until I feel like it's time for me to go back to doing the manual stuff. The percussion is the up-down pistoning action that's different than the vibration. The vibration is more of a general oscillatory maneuver. It's not pistoning, but that's one reason I like it on the trunk, because it's just less direct. It's nice on those more sensitive areas that don't have a bone behind them, as opposed to down here. This tissue's tougher, and we've also got her femur behind this, so it's just a whole different construct. And the tissue also down in the lower limb has got more collagen, less elastic. The trunk has more elastic and less collagen when you compare the two. So they just, I find they do better if you just think about them a little bit differently and maybe use a different tool. So I'll give this, I really don't time myself, maybe a minute or two doing this on her, and then I'm going to go back to the manual work, and I'm just going to move between these two, back and forth and back and forth, and try to get this area to slide better in the tissue layers, get it to where it's not so stuck together and painful, but also so that it's not pulling all the way up into her SI region. So all right, that was the medium speed. My Hyperice has 3 speeds, and I'm typically using the middle one, the second one. This Viper has, I think it's 3 settings, and I typically use the middle one on this too. But you can do whatever works best, whatever feels best. Now to me, already, this is starting to change, and Cindy's shaking her head yes. And now she's not having quite as hard a time to be quiet and not make awful noises, but you can make an awful noise. It's okay. You can say hello even if you want. Thanks for your participation here. So I'm on one point and just working to bring back the glide in the tissue layers that has been compromised because somehow this got overloaded. And actually her history was in college, she jumped off a roof.
And had an ankle reconstruction.
Yeah, and even at that stage, Cindy was into flight. She just wasn't in anything that would support her flying at that point. And so she had to have ankle reconstruction surgery. So the Viper just shut off. And so we're going to go back to that spot in just a moment. But it has a timer. I think it goes for about 8-9 minutes, something like that. I'm going to work on this a little bit more, and I'm going to go back up to that other place and see if using the Viper helps it to feel a little bit better.